The higher your level of leadership in healthcare, the more creative you have to be about listening to the ground. Because senior leaders cannot know everything from the top. They cannot see every patient experience. They cannot hear every staff concern. They cannot feel every workaround, every frustration, or every gap in the system. And that's real, and I have compassion for that. But here's where leadership responsibility comes in. So sometimes the CEO says, oh, well, I have VPs for that. And the VP might say, oh, I have directors for that. And the director may say, oh, I have managers for that. And then the manager is expected to be the bridge between the ground and everyone above them. But when every layer assumes the layer below is handling the connection, leaders at the top can become too far away from the people that their decisions affect. And that's when problems get missed. A program can look like it's working on paper, the reports can look fine, and the updates may sound positive, but on the ground, staff may not, or they may know that the process is just not working. And families may not be using the service, and maybe patients are even confused. The community itself may know that the program just doesn't fit real life. And that's the invisible pattern. The further decisions are made from the ground, the easier it is to miss the human side. And patient-centered leaders understand this. They find creative ways to stay connected to the people impacted by their decisions. They compare what is happening in the reports to what's happening in real life. They listen to staff, patients, families, and communities before major non-urgent decisions are finalized. Emergency decisions are different, of course, because leaders have to act fast. But in everyday system change, there's usually time to listen better. And that kind of listening makes leadership easier. You get more accurate information. You make better decisions. You create less resistance, and you build more trust. And you set the tone for every layer of leadership underneath you. And that's what patient-centered leadership helps organizations do. It creates a stronger through line between the people making decisions and the people living with the impact. So here's my stand. The higher you rise in healthcare, the more responsibility you carry to maintain a real connection to the ground. And if this message speaks to you, my book, Rooted to Rise, The Rise of the Patient-Centered Leader, is now available for pre-sale, and the link is in the bio. Remember, the further you are from the ground, the more creative and intentional you must be about finding ways to hear and see what's really happening.